Hello, this is Dr. Eric Bricker, and thank you for watching A Healthcare Z. Today's topic is the CEO of the most profitable not-for-profit hospital speaks out. So, today's video is based upon an interview performed by Blake Madden with Hospitology. It's a fantastic interview. I have no connection to Blake financially, but he is in Dallas and he puts together a fantastic newsletter, so I highly encourage you to sign up for it. Okay, now, he interviews Pete McKenna, the CEO of the Baylor Scott White hospital system here in Texas. And Baylor is huge if you're not familiar with it. Okay, it's 52 hospitals, it's got 30 ambulatory surgery centers, it's got 57,000 employees. This is not the Baylor that's in Houston. This is a totally separate Baylor. This one is in Dallas and Austin and Central Texas, okay? They do $15.5 billion a year in revenue. It's larger than the Cleveland Clinic, this huge international organization, Cleveland Clinic. Baylor Scott White is bigger. Okay, they had an 8.7% profit margin in the first quarter of 2024. Now, it's just one quarter's results, but that is more profitable than any other nonprofit hospital in America. Baylor, from a financial standpoint, is incredibly large and it's very financially successful. So what does a large financially successful hospital, what is their strategy? Well, shoot, if their CEO is talking about it, then we better listen, because they're not like strapped, they're not hurting. What is a high functioning, lucrative hospital system? What are they doing? Let's find out. Okay, their strategy is to focus on the customer. Notice, during the interview, Pete McKenna says this is really healthcare 2.0. This is new. This is innovative. Focusing on the customer, putting the patient first, is innovative for a hospital system. Well, listen, good for them. Okay, I mean, I agree. We should put the customer or the patient first. That's not necessarily. I think most businesses should probably do that. Okay, so I mean, good. Okay, great. I'm fully supportive of that. Okay, now how are they focusing on the customer? Their number one priority, interestingly, navigation. And as the co-founder of a healthcare navigation company called Compass, where we helped 1.8 million people navigate the U.S. healthcare system for 11 years, I know a little bit about healthcare navigation. Okay, so they're really focused on their app, okay? And we're gonna go over that more in a little bit. They've recently bought 41 urgent care centers, bringing their total number of urgent care centers up to 62. So they're really moving their care outside of the main hospital, where he says they're really moving from the quote-unquote heads in beds approach to really giving people care in other places. So before, hospitals really focused on getting inpatient volume. And now he's trying to shift that focus to actually on the customer. Maybe the customer doesn't want to be hospitalized. I would argue most people don't want to be hospitalized. So how can they deliver care not necessarily in a hospitalized environment? Okay, fine. They've got virtual visits for primary care and for specialist care too. And then they've added 24/7 postpartum care for women. Listen, that's super helpful. For any family, any woman that's had a baby, you know that at postpartum, having support is super important. Okay, so the interesting thing, what is the commonality across all these initiatives in terms of focusing on the customer? They're all related to access. They're all related to like getting in the door and getting through all the different doctors and facilities and tests and procedures, et cetera, which is fine. But there's this thing called the Quadruple Aim, which all healthcare organizations are kind of shooting for this Quadruple Aim. Okay, and access is one of the things on that Quadruple Aim. But the other things on the Quadruple Aim are affordability, and affordability is not in the sort of strategic priority for Baylor. It's around quality, and quality is really not around the strategic priority for Baylor. And then it's around sort of sustainability of the workforce. In other words, it's addressing burnout. Again, that's not what he mentioned. Now, I don't know. I mean, maybe Baylor has solved for those other three parts of the Quadruple Aim. I don't know. All I can say is that they discussed heavily issues of access. Okay, fine. Now, I went and did a deep dive on the app because listen, it's springtime in Texas. My allergies are horrible. I'm like, okay, I got horrible allergies. I don't see anybody for it. The Benadryl and the Sudafed really aren't working anymore. So what if I wanted to see somebody about my allergies? What would I do? Well, let's see what the app did. Okay, so first of all, I couldn't just look up a doctor. I had to create an account. And you can't use Apple or Google or Facebook, right? So a lot of times that's kind of the standard, is you use one of those other login mechanisms. You can't do that. You got to create your own login. You got to put in your email address. You got to put in your physical address. Interestingly, they ask you for your social security number right up front. Now, it's optional, But they right away, they're like, give us your social if you want. Okay. And then you have to create a password, of course. And then there are 7 pages of micro print terms of service. So of course, I didn't read that, and I signed my life away, and I agreed to the terms of service. And then you can skip sort of two-factor authentication. You can skip putting in your insurance information. You can skip getting access to your family members, right? If you have kids and you want to access their information. And then I skipped, sort of the messaging, signing up for messaging. Okay, so the point is that it was 9 steps to kind of get to the home screen where I could then actually look up a doctor for my allergies. And I would contrast that to Instacart, which is hugely successful and is also getting you access to a personal shopper to buy you things, okay? To use Instacart's app for the first time, it's 2 steps. You can log in with your Apple, Google, or Facebook account and you put in your zip code, and that's it. So just know that, and listen, I was a persistent consumer. I wasn't gonna let these 9 steps stop me, but it was just a lot more steps than what a lot of other apps that are trying to be user-centric. It's a lot more steps than the other apps are asking for. Okay, so, and then the very first doctor, I put in my allergies as my reason for visit, I put, zip code, yada, yada, yada. The very first doctor they give me is a family practice doctor in the town right next door. I mean, good location, but for available appointments, I clicked and clicked and clicked, and I got to October of 2026, and he still did not have any available appointments. So, maybe the app shouldn't put doctors up that don't have appointment availability. So I'm like, okay, I'll just go to the next person who is a nurse practitioner. Now, she had availability for the next day at 3 different times. So that was good. Okay, so the first person didn't work out, but the second person did. Okay, so overall, I would say that, okay, they're focusing on access, but I think it's remarkable that affordability is not, they're not competing on affordability. They're not competing on quality. They're not competing on the satisfaction or lack of burnout of their own employees. They're not competing by going at risk in value-based care. They're not competing with being more transparent in their pricing. So I would argue other organizations in healthcare actually are trying to address these things, right? So pharmaceutical companies absolutely are trying to address affordability where they have point-of-sale coupons. And there's a lot of businesses, you can just go to Amazon or whatever, and they give you financing right up front in the app for your service. So obviously, you can do whatever you want, but why doesn't Baylor do some sort of coupon thing? Or why don't they do financing? Because that's what other folks do. Okay, and the next up, for quality, there are other health systems that have made quality their #1 initiative, where Advocate in the Chicago, Wisconsin area, their #1 priority is patient safety. That's their #1 corporate initiative. And so I'm not saying that it's wrong for Baylor not to make these a priority, but interestingly, there was a survey of 1,201 Texans, and they asked them what they were concerned about with their healthcare. And the results of that survey showed that 68% of those surveyed Texans either delayed or skipped care entirely because of cost. So for over 2/3 of these surveyed Texans, affordability was a huge issue. And 43% of those survey respondents said that they had trouble affording their medical bills. So there seems to be this mismatch between are there people who want better access to healthcare and Baylor is addressing that particular need? Absolutely. But one would argue that issues of affordability and quality and burnout are arguably incredibly important to the customer as well. And just know that you as an employer who's paying for this stuff, you have hospital systems where it's not necessarily obvious that they're trying to make their services more affordable or doing anything about quality or doing anything about burnout. So again, I want to share that information with you because it's kind of telling, and that's my point for today. And thank you for watching A Healthcare Z.